All right. I think it's 9:59. We're close enough to 10 o'clock to get going. I'll keep letting people in as they join us. Good snowy morning, everybody. Hope you haven't gotten too much snow and are snowed in. Winter weather is officially here. I guess very appropriate for December 1st. I'll go ahead and introduce myself. My name is Lori Smith. I am the training coordinator with Direction Home, Akron, Canton Area Agency on Aging and Disabilities. I help Francine coordinate these seminars, but Francine by far is the Medicare expert. I just kind of follow where she leads. Before we do get started, I will go over some Zoom controls if you are not yet familiar. So I will have everybody muted by default, and that just helps keep background noises down to a minimum and distractions down to a minimum, and allows everybody here with us on this Zoom call today to be able to hear everything that is being given. We will stop periodically throughout this seminar to ask questions. So if you would like to make a comment or ask a question, I will ask you to open your chat box. So along the bottom of your screen, if you are here on a computer or a tablet, you should see a strip of menu options down at the bottom of your screen. You may have to move your cursor to make them viewable. I know mine disappear if I'm not moving my cursor. But you should see something that says chat, and the icon looks like a little thought bubble. If you click that, you'll see a chat window open to the side of your screen. And that's where you can type in your questions and comments. And as Francine pauses, she will ask for questions and I will read those out to her. And we'll just move along like that. You do have the option when your chat box is open to write a comment to everyone here with us in this Zoom session today. You'll see where it says to everyone, and everybody here with us in this Zoom session can see whatever you type in that chat box. If you want to send a message to one person in particular, you'll click the little down arrow next to where you see everyone, and you'll see everybody's name pop up, and you just choose who you want to send that message to, and then only that person will see it. I won't see it, Francine won't see it. It will only go to that person. But then again, if you want to make a follow-up comment and have everybody be able to see that, you will need to choose everyone. It does not go back that way by default. I will say that if the section of your screen where you see Francine's slides is a little bit too small for your liking, you can slide that panel left to right and adjust the size. If you move your cursor to the right of where you see her slides, and you may see a column of us, or you may have your chat box there, but as you move your cursor between those two panels, her slides and whatever is to the right of that, your cursor will change into a double-sided left-right arrow. And you can drag that panel left to right and adjust the size of her slides if, again, they are a little bit too small for you to see. You can see some of us here. We are sharing our webcams. You don't have to do that if you're not comfortable with it. By all means, you don't have to. But if you would like to, and I think it makes things feel a little bit more interactive since we're doing this virtually rather than in person now. But if you would like to share your webcam, again, in that strip of menu options at the bottom, you'll see something that says stop or start video, and you'll click that. That is what will turn your webcam on and off. I will ask though that if you are sharing your webcam, you just be mindful of your surroundings, what's going on. A lot of movement can be distracting. So if you pick your device up and carry it with you, if you decide to take a lap around the house, that can kind of be distracting. So if you do need to stand up and do anything, just turn your webcam off for that moment and then turn it back on when you rejoin us. If you are familiar with our in-person meetings, you know that we always have that packet of materials so that you can follow along and look at the Advantage plans and the MEDIGAP plans and all of that. I did email that out to everybody. Those who requested it by mail should have it by now, unless you registered within the last week or so. Those have not yet gone out in the mail, but they will shortly. Probably go into the office tomorrow or Thursday and get that sent out. But you should have received the email with the electronic version, so you at least have something to refer to as Francine is doing this seminar. And they are also posted to our website. And once we are done here today, I'll show you how to get to that page on our website with all of that materials. Copies of the slides are there as well, And then I am recording this session too. So if you want to go back and review, or if you know somebody who just wasn't able to get to one of these sessions but wants the information, they can go there and watch the recorded video. I think with all of that finally out of the way, I will stop talking and turn it over to our Medicare expert, Ms. Francine Chuchanis. Thank you.
Good morning, everyone. Welcome to Get Ready for Medicare 2021. I'm Francine. I have had the pleasure of working for Direction Home for 19 years now, and I'm happy to be here today with you. So let's get started. For those people who are going to be new to Medicare, your initial enrollment period lasts for 7 months. You can enroll 3 months before your 65th birthday and up to 3 months after your 65th birthday. Once you enroll early before your birthday, your coverage will begin the first day of the month you turn 65. If you are receiving a Social Security check, you will automatically be enrolled into Medicare by the Social Security Administration. If you are not receiving a Social Security check, you will have to enroll, and you can do that by going online to www.medicare.gov or by calling the Social Security Administration. If you happen to miss this seven-month initial enrollment period, you can enroll between January and March of each year, but remember your coverage will not start until July 1st. And those individuals under the age of 65 who have been disabled through the Social Security Administration for 24 months will automatically, after that 24-month period, be enrolled into Medicare. There are also some other special enrollment times. So if you move out of the country and come back, or you move out of your county or state, you may have a special enrollment period. When you move in and out of a skilled nursing facility, you are given a special enrollment period, and you can change your coverage at that time if you're already enrolled. And if you have coverage through your primary employer and you delay your enrollment into Medicare, once you lose that primary coverage, you also will have a special enrollment period. If you're already on Medicare, it is important that you check your coverage now. Starting in October, on October 15th through December 7th, you can change your coverage. For those of you who have been in a Medicare Advantage plan, like let's say SummaCare or Anthem or Primetime, any of those, you should have received what's called an annual notice of change, which tells you how your coverage will change for 2021. If you did not receive this by mail, it may be online at your plan's website. And changing coverage during this time period includes any Medicare beneficiary, even those who have both Medicare and Medicaid. So when we talk about Medicare and its coverage, there are really only two choices. People get confused, but we're going to try and simplify it for you. You have two ways you can get coverage under Medicare. The first way is by joining a Medicare Advantage plan. The second way is just to remain in what we call traditional Medicare. But there are advantages and disadvantages to these choices. So with a Medicare Advantage plan, if you want to join one, you must have Medicare Part B. These are private plans that contract with the government for Medicare. They are not supplemental plans. Supplemental plans are something different, which we'll touch upon a little later. Most of these Medicare Advantage plans include drug coverage. So you have your Part A, your B, and your Part D all wrapped into one, and you have one membership card that you use when you go to the doctor or you go to the pharmacy. All Medicare Advantage plans have to cover everything traditional Medicare covers, but they are allowed to have extra benefits. So some of these plans include benefits like dental coverage, vision coverage, fitness coverage. Also with these plans, there are out-of-pocket limits. And what that means is once your out-of-pocket costs reach a certain amount, you will be fully covered by the plan. One thing that some people don't like about these plans is that there are geographic restrictions. If you look in your packet, you'll see that you received information on these plans, and it is by county. So the coverage in different counties is different, and the coverage in different states is different, even if those plans are national plans. There are also provider restrictions. So in many of these plans, you have to use their hospitals, their doctors, and their other medical providers. With traditional Medicare, there aren't those extra benefits like vision or dental or hearing or fitness. Also, there are no out-of-pocket limits, but people can add what we call supplemental plans, which again, we will touch on a little bit later. And those plans are plans that can pay for your out-of-pocket costs. Also with traditional Medicare, if you don't have drug coverage through a current employer or previous employer or retirement plan, you must add what we call a standalone Part D plan. What is good about traditional Medicare that some people prefer is that there are no geographic restrictions. So you can get care at any provider throughout the United States as long as they take Medicare. There are also no gatekeeper or prior authorizations required. So with the Medicare Advantage plans, sometimes before you get a medical service, you have to get prior authorization from your plan. That does not happen with traditional Medicare. And of course, there is an open provider network as long as those providers do take Medicare. So the choice is yours. You will see as we talk about Medicare Advantage plans that some have premiums, some don't. Again, you have to have Part B, so you're going to pay the Part B premium. Most of them do include drug coverage, but you cannot buy any supplemental coverage with those plans. With original Medicare, we'll talk about Part A, where most of us don't have a premium. Again, Part A is going to cover certain things, and Part B is your medical insurance, which we'll touch on. And there is a premium for Part B. You would have to add drug coverage, but you can purchase supplemental insurance to cover your out-of-pocket costs. So let's take a look at traditional Medicare Part A. And one of the things Part A covers is your hospitalizations, your hospital insurance. Typically, as I mentioned, there is no premium for Part A as long as you or your spouse have worked full-time for 10 years, or what the Social Security Administration calls 40 quarters. So we've already paid into the system. So when you were working or your spouse was working, there was a chunk of money taken out of your paycheck for Medicare. This is where it went. When you enter the hospital in 2021, you will have a deductible to pay, and that deductible next year is going to be $1,484. That will cover you for 60 days. If for some reason you have a catastrophic illness and you're in the hospital for a longer period, for days 61 through 90, you will have a daily copay of $371. If you're in the hospital longer than 90 days, you can use what's called lifetime reserve days, but those are you're only allowed to use those once in your lifetime. And that would cover you for days 91 through 150, but you would have a daily copay of $742 per day. Medicare Part A also covers skilled care in a nursing home. Now, by skilled care, what I'm talking about is physical therapy, occupational therapy, speech therapy, or daily monitoring by a skilled nurse for your care. Medicare does not cover custodial care. So if someone's in the nursing home just because they need help bathing, or they need help eating, they need help dressing, that is not a reason that Medicare will cover them. Medicare covers for therapy services. Under traditional Medicare, typically a person has to have a 3-day hospital stay before Medicare will cover them in a nursing home. Unless they are in a hospital for COVID, the 3-day hospital requirement is now waived. That 3-day hospital stay also does not include the day of discharge. So the person is you would really actually have to be there for 4 days. And if you are not admitted to the hospital, but they put you on what's called observation status, that would not count for that 3-day hospital stay. So once you are in a skilled nursing facility for therapy, Medicare will cover you in full for 20 days. After 20 days, you would pay a daily co-payment next year of $185.50 per day. And Medicare will only cover you up to 100 days. But I have to emphasize that it's very difficult to stay skilled for 100 days. You would have to be very medically complex for that to happen. Once you are no longer receiving skilled care in a nursing home or a hospital for 60 days, you can start a new benefit period. Now, for people who are in the nursing home now and are there and have had COVID, this 100 days of coverage can be extended at this point, but it is actually up to the provider or up to the nursing home to decide if that will be done. Part A also covers hospice services. Hospice is comfort care and is not for curative treatment. Hospice includes services for pain relief and symptom management. It also has coverage for drugs and durable medical equipment for pain relief and management. Drug copays while you're under hospice are no more than about $5. It can include aid and homemaker services, spiritual and grief counseling, but it does not cover room and board if a person is in a nursing home. It would only cover the services I just described. If a person is at home receiving hospice services, and let's say the family needs a break, or they're going on vacation, and so they are putting the person in the nursing home for a short period of time, there is a 5% copay for what we call inpatient respite care. The second part of Medicare we're going to talk about is Medicare Part B, which is medical insurance. And Medicare Part B covers things like your doctor visits, wheelchairs, canes, things of that sort. It also can cover some injections and some medications not covered by Part D. The premium, everybody has a premium for Medicare Part B, and the premium that you're paying is going to vary depending on when you entered Medicare. But next year, the new premium will be $148.50 per month. There is a yearly deductible, and that yearly deductible will be $203 beginning in January. So when you first start going to the doctor or you're getting other services covered under Part B, you're going to have to meet that $203 deductible before coverage will kick in. So once coverage does kick in, you do have a 20% copay, and that is 20% of the Medicare approved amount, not 20% of what the provider is charging. This 20%, however, is usually waived for most preventive services like mammograms, colonoscopies. Part B is also income adjusted. So some people are going to pay more than that $148.50 a month. If you are single and your income is more than $88,000 a year, or you're married and your income is more than $176,000 a year, your premium will be adjusted upward. Now, next year, the cost of living adjustment for those on Social Security was increased by 1.3%. And that turns out to be an average of about $20 per month for Social Security recipients. And because the premium increase is less than that $20 a month, so it jumped from $144.60 to $148.50, because your increase covers that jump, everybody will see that increase in their Part B. Some of you out there can actually delay your enrollment in Part B. So if you or your spouse have medical insurance that's primary to Medicare through a current employer, you can delay Part B. So an example of that would be, I work for Direction Home. I have medical insurance through Direction Home. Therefore, I wouldn't want to pay that Part B premium right now because I already have coverage that's primary to Medicare. So I would delay my Part B. To do that, you need to call the Social Security Administration or go on their website and request that your Part B be delayed. If for some reason you are covered by medical insurance through an employer and you lose it and choose to have coverage through COBRA, please know that you only have 8 months to enroll in Part B. Even if your COBRA coverage lasts for longer than 8 months, you must enroll within 8 months in Part B. And if people do not enroll in Part B when they are first eligible, there will be a late enrollment penalty, which will be carried through your lifetime, and it will be 10% of the premium for each month you were eligible and did not enroll. So make sure you are enrolling in Part B at the time that you're supposed to. So as I went through Parts A and Part B, you can see that there are some out-of-pocket costs, and some of these costs can get pretty expensive. So to cover those out-of-pocket costs, some people choose to buy MEDIGAP or supplemental plans. Again, these are not Medicare Advantage plans. Medicare Advantage plans are something different. So if you received a packet, you should have a chart that shows you all the MEDIGAP policies that are sold and what type of coverage they have. They're standard plans, so Plan A or Plan K is the same in California as it is in Ohio. You cannot have both a supplemental plan and a Medicare Advantage plan. All of these plans carry monthly premiums, and the premium is going to vary by the company that sells the plan. So it's kind of like car insurance. You have to shop around. Let's say one company might sell Medigap Plan A for $67 a month, and another company might sell that same coverage for $90 a month. So it really pays to kind of shop around. Last year, the government discontinued Plan C, F, and a high deductible F to all enrollees who were new to Medicare this year. There is a grandfather clause, however. So if you already had one of these plans before last year, you can keep that plan. But I have to warn you that the premiums for these plans will probably increase as time goes on because they're not adding new enrollees. So there is that grandfather clause. Also, if you enrolled in any part of Medicare, so last year, so let's say you enrolled in Medicare Part A, but delayed your Part B enrollment because you or your spouse has insurance primary to Medicare, you also can still purchase those plans because you were enrolled into Medicare. These plans, however, do not cover prescriptions, they do not cover long-term care, and they don't cover extra benefits like dental or vision care. There are some times when you have what we call guaranteed issuance rights. So the best time to buy a supplemental plan is within the first 6 months that you are enrolled into Medicare, because during that time, these insurance companies that sell these plans cannot ask you about any pre-existing conditions, and therefore cannot charge you higher premiums if you have pre-existing conditions. Also, if you are new to Medicare and you joined a Medicare Advantage plan in the first year you joined Medicare, if you would like to buy a Medigap, if you change your mind and you didn't like the supplemental policy, you can buy a Medigap policy if you do it before your first 12 months of enrollment ends. For those individuals who have lower incomes, there are programs to help them pay for their Medicare deductibles and their premiums and their copays. And these are called Medicare savings programs. So I have included for you the income limits from last year. These will probably change by March a little bit. In March of 2021, but right now, you will see the income and the resource levels. Resources are cash, stocks, and things of that sort. There are 3 different levels, And QMB is the most extensive level, and that's qualified Medicare beneficiary. And that's where a person gets all their Part B premiums, all their deductibles, and all their co-pays paid for by the government. There are 2 other programs that will pay for a person's Part B premium. And again, that Part B premium next year is going to be $148.50 a month. So if you are in these levels, or you know someone who might be, they can contact the Department of Job and Family Services to apply for these Medicare savings programs, or they can contact Direction Home, our resource center, and we will help them fill out an application. Okay, I'm going to stop there and see if there are any questions so far.
There aren't any questions in the chat box yet. And just a reminder to everybody, if you do have a question or want clarification on anything, go ahead and type that. As I say, that one just came in.
Okay.
So this is from a case manager. Hello, a few of my members who have received a card stating to contact 1-844-259-4333, that phone number, to add up to $148.50 back into their monthly Social Security check, adding back Part B premium payment. Is this real? Should they contact Social Security?
Any of the all of our clients are on Medicaid. They're automatically enrolled in QMB. They do not need to do that. I have seen a commercial for that phone number. That only applies to people who fall in the income limits that I just had on the previous slide. But anybody on Medicaid already has their Part B premium paid for. And they're getting that money back.
Does that answer that question, I hope? Okay.
Okay.
Does the late enrollment penalty apply if the spouse is still working and providing insurance?
No. But that's why you have to delay your Part B so that you don't get a late enrollment penalty. So you have to call you have to let the Social Security Administration know you are delaying that Part B coverage.
Okay, that's all the questions so far.
Okay. All right, so we'll talk about prescription drug coverage. And what you see on this slide is what we call the minimum standard benefit that every insurance company that provides a Part D coverage has to have. So in 2021, plans, companies that sell the prescription drug coverage can have a deductible, but it can't be higher than $445 a year. And that's up a little bit from last year. Then we have the initial coverage limit. And next year, that's going to be $4,130. And what that means is once what you spend went away. Well, it did to some extent. You used to have to pay a lot more for prescriptions when you fell into this gap. Now the amount you're going to pay is going to be 25% of the your copay will be 25% of the cost of your medications when you're in the gap. And then once all of your out-of-pocket expenses, your personal out-of-pocket expenses, reach $6,550, you would enter what we call catastrophic coverage, and you would only pay 5% of the total cost of your drugs, or $3.70 for generics, and $9.20 for brand name drugs. As I mentioned, Part D is included with most Medicare Advantage plans, but so you have 2 choices. If you join a Medicare Advantage plan that has Part D, and most do, it's wrapped into your Medicare Advantage plan. If you're on traditional Medicare or you joined a Medicare Advantage plan without drug coverage, and there are a few, you would have to select what we call a standalone Part D plan. And in your packets, you should have a chart that has a green banner at the top that lists all of the standalone Part D plans in the state of Ohio. Now, if you have coverage for prescriptions through the VA, or you have coverage through a retirement plan or current employer that is considered creditable under Medicare, you do not have to join a Medicare Part D plan. However, if you do not have coverage, you need to join a Part D plan. And it's very important because even if you don't take prescriptions, if you become ill in the middle of the year, you're not allowed to enroll in Part D. You have to do it at the specific time you enter Medicare, or right now. If there's open enrollment, so if you're on Medicare and you never got a Part D plan, you might want to do that now. But if you're late and you didn't enroll when you first entered Medicare, you will have a lifetime late penalty again that will be 1% of the average national premium for each month you were eligible but did not enroll. So remember, you cannot enroll mid-year. Do not wait to enroll and get prescription drug coverage, even if you don't take medications. So to decide how to select Part D coverage, you should really look at your plans yearly. So you want to look at your coverage every year, whether you're on traditional Medicare with a standalone plan or you're on a Medicare Advantage plan, because the cost for your medications change yearly, and so do the formularies sometimes. So some of your drugs that might have been covered in this year may not be covered next year by the plan that you're already in. So to conduct an analysis, you can go to the Medicare website, which again is www.medicare.gov, or you can call the Ohio Senior Health Insurance Information Program, OSHIP for short. And I have their phone number listed here. You have it in your packet, or you can call 1-800-MEDICARE. And as long as you can give them a list of your prescriptions and the dosages you take, they can conduct an analysis for you. And the analysis will show you which plans would be most cost effective for you. Like with Medicare Parts A and B, there's also extra help for individuals with certain incomes. So for a full subsidy, meaning that a person can get a Part D plan having no premium and pay very low copays for their medications, I've listed the income levels and resource levels again. So there's a full subsidy. There's also a partial subsidy for those with incomes a little bit above the numbers that you see on this chart. So people might get have to pay a premium, but they can get reduced premiums and still get lower copays. And to apply for extra help for Part D costs, you can go to the Social Security website at www.socialsecurity.gov, or you can call Direction Home at 1-800-421-7277, and we will help you fill out the application. So please be aware of that. And if you feel you qualify or someone you know might qualify, have them call us and we'll be glad to help. All right, I'll stop there before I go to Medicare Advantage plans.
Okay, so is the spouse eligible for Medicare coverage and what are the requirements?
I'm not sure I understand that question. As long as a person, well, you're eligible for Medicare coverage and you will have no premium for Part A if you or a spouse worked full-time for 10 years. If you worked less than 10 years, then there will be a premium for Part A and Part B. So I'm not sure if that answers that question.
Cassandra, I don't know if you want to unmute yourself real quick and let us know if that answers the question or if you need more clarification.
Okay, what I want to find out is if the spouse is covered under Medicare, and let's say the spouse is only 58, is she able to still get the insurance, the Medicare?
You mean the Medicare, like go to a Medicare Advantage plan?
Yeah, with her husband or the husband with the wife.
Well, they would both have to be eligible for Medicare.
Okay, that's what I wanted to find out. Okay, that
Yeah.
answers my question.
Yes.
Okay,
Yeah. Okay.
thank you.
Thank
You're
you.
welcome.
And that's it so far.
Okay. Then I'll move to a discussion of Medicare Advantage plans. Medicare Advantage plans, again, you have to have Medicare Part B to enroll in a Medicare Advantage plan. Many of these plans, unlike traditional Medicare, and this is outside of our COVID world right now, many of them don't require a 3-day hospital stay to get rehab in a skilled nursing facility. Most of these plans do include drug coverage, a few do not. If you are joining a plan that does not include drug coverage, you would have to choose a standalone prescription drug plan. So if you got your packet and you pull out this very colorful chart of Medicare Advantage plans in the county where you reside, I will point out that the last page of that chart includes Medicare Advantage plans that don't have drug coverage. The rest of them all have drug coverage. You will also see that you will see that we have listed the premiums for each plan. We have also listed the out-of-pocket maximums. So if you're a person that has high medical costs or are anticipating having high medical costs next year, you want to choose a plan that has a low out-of-pocket maximum. Those maximums can range anywhere from $3,400 a year up to over $10,000 a year. So you would want one with a lower out-of-pocket maximum. You will also see in the chart, we've listed the star ratings. 5-star is the highest rating plan. 1 would be the lowest. We don't have any 5-star plans in our region this year. We do have some 4.5-star plans, and we have several 4.0 star plans. So take a look at the star ratings. You'll also see where we have listed whether you have a choice of doctors. Some plans allow some choice. So typically, if next to the plan name it says HMO, that stands for Health Maintenance Organization. And that means that you will have to use the plan's doctors and other providers. If it says POS, that's point of service, that means that your primary care physician can refer you out of network. And if it says PPO, that's a preferred provider organization. You will be allowed to go out of network with preferred providers, but you might pay a little more on your copay. Also on that chart, we have under the monthly premium, some of those plans you will see that there's a medical deductible, and that means you would have to meet that medical deductible before your coverage under the plan would kick in. And that medical deductible does not include any deductible for prescriptions. Many of these plans have extra benefits. From what I saw this year, they all have some sort of fitness benefit. All of them cover telehealth services. Some have benefits for over-the-counter medications or other things you can buy to the drugstore. So they might give you a certain amount of money that you can use to pay for over-the-counter items. Many of them include dental, hearing, and vision coverage, but typically that coverage is limited. There are a few of those plans that do have more comprehensive coverage, and when they do, they can charge you an additional premium for the comprehensive coverage for these services. And then all of them have opiate recovery and treatment programs for next year. In addition to the typical Medicare Advantage plans, there are also 2 Medicare savings plans that are available to individuals in our region beginning next year. These are high deductible plans, so they only cover your medical costs once you meet the deductible. What they do is they establish a medical savings account for you, and they deposit money into an account every year, which you can use to pay for any of your healthcare costs. However, only services covered by Part A and B count towards that deductible. Be aware that even with these plans, you cannot be charged more than the Medicare approved amount by any provider. And once you reach the deductible amount, the plan will cover all your Medicare costs. If you have money left in the account at the end of the year, that money is automatically transferred and rolls over to the following year. So those are a little bit different. So you might want to talk to, if you're interested in that, you might want to talk to a broker. We also have what we call some special needs plans. And these are plans that cover certain people. So there is a plan for people with chronic conditions like diabetes or heart disease. There are plans for people that live in nursing homes. And there are separate plans for people who have both Medicare and Medicaid. I did not include these in the chart. They can be very confusing to people. Some of these do have premiums. Some of them do have medical and drug deductibles. The benefits vary with each plan, and they should always be compared to other choices. So if you're contacted by an insurance agent that is selling one of these plans, you want to really take time to look at the benefits that you currently might have and compare those to any benefits they're describing in the special needs plans. For those people who have both Medicare and Medicaid and are on what we call MyCare Ohio, I would caution you to compare those benefits carefully, especially when you're looking at the benefits that deal with vision and dental and those types of services. Speaking of MyCare Ohio, MyCare Ohio is a demonstration program that was begun in Ohio in 2014. And what the state did at that time is they told people that had both Medicare and Medicaid that they had to pick specific plans to cover their Medicaid, but they could also choose these plans to cover both their Medicaid and their Medicare. In our region, there are two choices for people who are eligible for MyCare. One is to enroll into CareSource, and the other one is to enroll in United Healthcare. And again, you have to choose one of these for Medicaid coverage, but you can also choose to what we call opt in and have these plans cover both your Medicare and Medicaid. If somebody opts in and has them cover both their Medicaid and Medicare services, you can be eligible for extra benefits. And those extra benefits can be monies to pay for over-the-counter items. It could be not having any copays for your prescriptions. It could be getting extra transportation to your medical appointments. So for those of you that are eligible, you might want to look at those extra benefits. But you can also choose, just like anybody else, you can also choose to have your Medicare coverage elsewhere. You can still choose to have a Medicare Advantage plan. You can choose to stay on traditional Medicare. So you have actually three choices. You can do the traditional Medicare, you can do the Medicare Advantage plan, or you can opt in and have CareSource or United cover your Medicare services. When I looked at regional plan changes this year, there was a big increase in the number of Medicare Advantage plans in Summit, Stark, and Portage counties. We have 77 plans this year. I think there were maybe 48 last year. 8 of those plans do not have drug coverage. And again, those are the ones that don't have drug coverage on the last page of your chart. In Stark County, there are 66 plans with drug coverage and 7 without. In Portage County, there are 64 with drug coverage and 6 without. And in Wayne County, we have 49 plans with drug coverage and 5 without. The premiums for these plans from this year to next year have remained relatively stable. I did see some increases in those out-of-pocket maximums. And in a couple of those plans, the increase in the out-of-pocket maximum was substantial. So you want to pay attention to that. Many of the plans, though, showed really low copays, for visiting your primary care physician. Some of the plans have 0 copays for visiting your primary care physician. If you see specialists, you want to take a look at what you're going to pay to see a specialist, because the costs are going to vary by plan, and they can be as low as about $30 a visit, upwards to $50 a visit. So if you see a lot of specialists, pay attention to that. And then we have the addition of 2 new companies to our region in 2021, and they are Bright Advantage and Devoted Health. You will note on the chart that neither of these plans has a star rating because they're new to our area. So we won't expect to see a star rating for them until next year. So how do you select? Well, you want to look at the cost for the services you use most. As I mentioned, if you see a lot of specialists, you want to look at what you're going to pay per visit to see a specialist. If you know you're going to have a knee replacement and you're going to be in the hospital, or you're going to go for therapy in a skilled nursing facility, you want to look at the cost for that. You also want to look at the drug formulary of the plan. Does it cover all the medications that you take? You want to look at whether the plan includes the doctors and the hospitals that you choose to go to. And then if you're interested in extra services, what extra services does the plan take? There are companies, for example, one of them would be Anthem, Blue Cross Blue Shield, that has a number of different plans to choose from. Many of the differences in these plans are very subtle. So if you're interested in that company, you want to take a look at the differences between each plan. And of course, you always want to look at the star ratings, and you want to take into account the plan reputation. And by that, I don't mean just listening to your neighbor or your friend that says, oh, I have XYZ plan, it's great, I think you should get it too. Because these decisions are very individualized. It's good to talk to your doctor's office. They work with these plans, and they can tell you how easy the plan is to work with. You know, if they have a hard time getting prior authorizations, if they have a hard time getting paid by the plan. So your doctor's office can also be a source of providing you with information about the plan. Every year, again, you can get the information you need by having an analysis done. Either you can do it yourself or have a family member do it by going to the Medicare website, or again, you can call OSHIP or Medicare and give them a list of the prescriptions, tell them about what services you're most interested in, and they will conduct an analysis for you and help you make an informed selection. So choose wisely. You can only switch plans during certain times of the year. Now is the time, it's open enrollment. You can change your coverage for next year if you would like to. Also be aware that if you decide to join a Medicare Advantage plan and then you change your mind in the first 3 months of the year, you can switch back to traditional Medicare between January and March 31st of each year. If you have both Medicare and Medicaid, be aware that you're only allowed to switch once per quarter in the first 3 quarters of the year. Questions?
We've got a few here.
Okay.
The first is, are there any Medicare Advantage plans or MEDIGAP plans that are providing home health aid services or home delivered meals?
There are a few that provide home health services, but you'd have to meet Medicare requirements to get home health. And there are a couple who also do the home delivered meals. There was no way for us to search by that. You would have to go into the specific plan and see if that would be covered.
The next one says, if Jill is covered by Medicare with Parts A and B, and her spouse is only 60 and still working and covers the both of them by the spouse's employer, with employer being the primary, will it save money if Jill stays covered by Medicare only and enrolls into Plan D and the spouse stays covered by his employer?
It depends on, okay, so if you have a spouse that's working and you can get coverage through the spouse's employer, you have to look at how much it's going to cost to be under the employer's plan as opposed to being under Part B of Medicare. So that's going to vary based on the circumstances. So you're paying next year a premium for Part B of $148.50 a month. You have a 20% copay for Medicare Part B services. You also might be paying for a prescription drug plan. So you want to look at the costs under Medicare compared to what it would cost you to disenroll from Part B. You can do that as long as you tell the Social Security Administration you have coverage through an employer that's primary to Medicare. So what are the cost differences there?
Okay. The next one is, I know that open enrollment is October 15th through December 7th. Can those that enrolled in Advantage plan choose to change in the first 3 months of the year? So can they switch Advantage plans anytime between January and March?
I do not believe they can do that. They can only switch to traditional Medicare.
Okay. Those are the only questions we have at this time.
Okay. So I'm going to go over a few of the changes that we have in Medicare. There is, next year, there will be a 2-year demonstration model called the Senior Savings Model for Prescription Drugs. So there are going to be some plans that are going to offer a copay for insulin of only $35. There was no way for me to search those out when I did the charts. But if you do an analysis and you enter your prescriptions and you enter the insulin, that should show up and show you which plans would be most cost effective for you. So I don't know which plans are going to offer that, but there are some that can choose to do that next year. Also, people with end-stage renal disease. It used to be that they were not permitted to join Medicare Advantage plans. They currently are permitted, effective 2021, to enroll into a Medicare Advantage plan. Also, if you have delayed your Part B, or you want to delay your Part B, but if you delayed it and you need to get your Part B, you will have to make application for that on the Social Security website. Social Security is currently not seeing people in person unless there's a life-threatening reason that involves food or shelter. So, and you can also call the Social Security Administration. You will have to leave a voicemail, but someone will call you back. Changes related to COVID-19. So if you're covered by Medicare, you're not paying you're not going to pay for the COVID test, and you won't have to reach your deductible, and you will have no copay. Medicare Advantage plans are allowed to reduce cost sharing for COVID-related treatments. Also, Medicare Advantage plans have to cover out-of-network services that are provided related to COVID, and they can't charge you more, so it would just be your regular copay. The 3-day hospital stay is waived for skilled care. If a person is in the hospital and there are COVID-related circumstances. And then you've all heard there is a vaccine coming. It will be covered in full. There will be no copay, and you will not have to meet the deductible to get the vaccine for free. Each year, the Medicare trustees do a report on the status of Medicare in the United States. The report this year said that the Hospital Insurance Trust Fund for Part A will be solvent until 2026. It was improved 9 years by changes that were made through the Affordable Care Act, which resulted in savings to Medicare. Also, we have to remember that Part A, remember, we're paying an amount out of our paychecks, and our employer is paying an amount out of our paychecks. So it's financed by both employer and employee taxes. The report did not take into account the unemployment that happened as a result of COVID. So that may change that solvency date a little bit, but we won't know that till next year. For parts B and D, they are adequately financed because they're financed through the General Revenue Fund and monthly premiums to beneficiaries that account for 25% of the cost. It's estimated that by 2093, B and D are actually going to consume 35% of a person's Social Security check. It was only 23% in 2019. So the costs for these services are expected to go up. And so these are things that Congress is going to have to deal with in the future, in the very near future. Medicare costs in 2018 accounted for 3.7% of the gross national product. That's going to grow to 5.9% by 2038. And that's due to the baby boomers entering the Medicare system. Every year I do a section on legislation, and I have to tell you that as a result of this year being an election year, legislation was pretty much stalled when it came to Medicare. There was a resolution called Resolution 3 that passed in the House, and that resolution was an attempt to decrease prescription drug costs under Medicare, but it was not taken up in the floor of the Senate. So we'll have to wait for more to come there. And that's all I have.
All right, I don't see any new questions that have come in. If you do have any additional questions, please get those typed into the chat box and I will read them out to Francine. In the meantime, I will show you how to get to the Medicare.gov website so you can do those plan analysis reviews, and to our website where you can get all of these materials. So let me share my screen here. First one is Medicare.gov that Francine referenced. This is what it looks like when you go to their main page, just www.medicare.gov. If you would like to get those plan analysis, you'll click this button right here where it says Find 2021 Health and Drug Plans. And when you click that, you'll see that they are asking you to log in or create an account. You do not have to do that. You can click right below where you see it says Continue without logging in. You can create an account if you want, but you don't have to. It will take you through some questions about the type of coverage you're looking for. It will ask for your zip code. That is fine to put in. And then once you're done answering all those questions, it will give you some suggestions as to plans that would be a best fit for you. So that is how you will go through and do all of that. Now our website, if you would like the information, the supplemental information that we always offer each year. Again, if you requested it by mail, you should have it by now. If not, everybody should have had it emailed to them. If you don't, let me know and I will get that back out to you. But everything is also posted to our website, and that is www.dhad.org. And then once you are there, you'll see this blue ribbon across the top. You'll choose the resources and education. And you can see when I put my cursor over that, that menu automatically populates. You will go down to the fourth option to Medicare Education. And when you click that, you will have to scroll down to see the information. We talk about everything that is included in our Medicare seminars, and this year about how we've done them virtually. Again, if you want to review the content that Francine shared with us, there is a video. You can get to that by clicking here. I will say the video that we have posted currently was recorded before the Plan A and B numbers were released. I will be posting this one that we recorded today, so you will have that updated information if you choose to watch the video. It will take me a few hours to get that up there, but it will be up there. But no, the one that is up here now is an older video. If you want the materials, and all of those are updated, you can continue to scroll down. Again, here's a link to the video, the Medicare FAQs that we commonly see, and the slides that you just viewed as Francine was giving her presentation. You can click all those links and get to those. Below that is the Advantage plans for the counties that Direction Home provides services and supports to. If you need something other than the county in which you live, or if you know somebody who would like that information. Below that is the Part D and MEDIGAP information. And then further on down below is just information that is nice to have. It's got a nice booklet of all the preventative services that Medicare has and a list of those. A card that you can take into your healthcare team with questions that you may want to make sure you're asking. And then the Ohio Medicare Savings Program, information on women and heart disease, and then 2020 and 2021 HEAP information if you know anybody that needs energy assistance. And then on down below that is a link to get to the Ohio Senior Health Insurance Information Program. That can also give you a Part D analysis if you would like. So all that is here. Again, going to www.dhad.org, going to the resources and education, and down to Medicare education is how you get there. I will also let you know if you have any other questions about the services and supports that Direction Home can offer, and it is numerous. I encourage you just to go to our main website and look at our Aging and Disabilities Resource Center. You can look at I Need Help, and that can give you an idea of anything that we can help with. And if you have any questions, I encourage you to reach out to our Aging and Disabilities Resource Center. You'll see it abbreviated ADRC. That number is also this 1-800 number up there. They are free to contact and give, again, unbiased information about any services, supports you or someone you know might need to be able to live in the place that they want to call home and are comfortable there. And I will stop sharing and see if we've gotten any new questions. No new questions that I'm seeing.
Okay, well, I want to wish you all a very happy and healthy holiday season. We've enjoyed speaking with you today and hope to be able to see you in person again next year.
Fingers crossed, everybody. Thank you for joining us. We know this isn't the in-person that we like to have, but thank you for joining us in this virtual world here today. Thank you.
Thank you.
Thank you.